Honorary Secretary, Rotarian Hospital, and our today's chief guest, Rotarian Dr. Srinivasan. So at the outset, I take this opportunity to thank our President for giving me this opportunity. So, our own member, Dr. M. Srinivasan, is here. I think he is coming after a long gap to our club. So, he is here to talk about robotic surgery for knee pain relief. I welcome you, sir. I welcome our President, Secretary, and all our members and guests. Thank you.
Thank you, Rotarian Melodious Christopher. Now I request the Honorable Secretary to read the minutes of the previous meeting.
Good evening, everybody. The 11th meeting of Rotary Club of Nagercoil was held on 11/9/2025 at RCC. The meeting was called to order by Rotary by 8:15 p.m. by the President. Rotary invitation was read by Rotarian Engineer Ravi Kumar, Rotarian CJ Gabriel read the four-way test, Rotarian Secretary S. Muthukar Pandulai and read the minutes of the last meeting. Rotarian Dr. Goba Kumar welcomed the gathering. The Rotarian Dr. P.P. Dr. Annaslam disseminated Rotary information. The agenda of the day was Teachers' Day celebration, Onam celebration, and also family meeting. The following teachers who attended the meeting were honored: Dr. U. Arnaslam, PDG Jacinda, Madam, Rotarian B. Vijaykumari, Rotarian A. Melodious Christopher, Rotarian Miss Sylvester Class, Rotarian Dr. Fresh Baller, Rotarian Dr. S. Jacob Roja, Rotarian President Maria Sylvester, Rotarian Engineer J.S. Sarul, Rotarian First Assistant Governor Dr. Dedi Padova, and Rotarian Goma Kumar. The Teachers' Day celebration, next agenda was Onam celebration. Rotarian P.A.G. Krishna spoke about the importance of Onam. The meeting next agenda was the family meet. Rotarian Goma Kumar conducted small sports. First sport was lighting the candles with the aid of one matchstick. Dr. Arnasalam lit 3 candles. Rotarian I lit another person. Ayyappan, Rotarian Ayyappan lit 3 candles. Rotarian C.J. Gabriel also was able to lit 3 candles. Dr. P.P. Dr. Jacob Raja was able to lit 4 candles. Rotarian Melodious Christopher lit 4 candles. Rotarian Engineer Ravi Kumar was able to lit 3 candles. Rotarian Ravichandran lit 11 candles. Rotarian Engineer J. Sarul lit 5 candles. Rotarian Rajendra Babu was able to lit 5 candles. Rotarian Radhakrishnan was able to lit 9 candles. Rotarian Radhakrishnan lit 7 candles. Ladies, Dr. Dedi Padova was able to lit 6 candles. Rotarian Drexley Joseph was able to lit 5 candles. Rotarian Masunda was able to lit 7 candles. Monthly bulletin was released by Dr. Dedi Padova and the same was received by Rotarian Dr. Jacob Raja. Vote of thanks was done by Dr. Ravi Badwa. Prizes were distributed to the winners of the sports. The meeting was adjourned to dinner after national anthem. Thank you.
Thank you, Rotary Secretary Rotary Mr. Garbhule. Can the minutes be passed? A warm good evening to all of you who are present here, dear Rotarians. I'm happy that you all are here today which is a very good topic what we are going to do now. Because as we all are aging, we all have aches and pains in the knees, in the backbone, and the legs that has been the part of our life. So, hearing from Dr. Srinivasan is going to be a very good help for us to manage our lives with the aches and pains. And lastly, indeed, I was very happy. There was a good attendance last week, and I do believe that we all enjoyed last week's program. It was taken for each and everybody to take part. It was such simple games that were played that were organized by Kumar. Indeed, I want to say thanks to him, but he is not here today. I want to say one more thing. DG has announced Rotary Benefit Card. This card is given to each and every member of Team 212, and this benefit card is for, many of our Rotarians run their own business. Benefit card or privilege card? Anybody has a business and we Rotarians go there, you will be getting 10% discount. Maybe shops or construction or hospitals, whatever it is. So even if it is for advocates also it goes. Okay? So advocates also you have to apply this. If your Rotarians come to you with your card, you have to get 10% discount. Okay. Okay, so that has become only till June end. Doctors also, I said doctors also. So and they are charging 50 rupees per Rotarian. I want a suggestion from you all whether we can ask individual 50 rupees or the club can pay for it. We have to pay when we go there for public image seminar. Then they will give us the card, we can calculate from there account. So I want your suggestions. That's what we want to ask. Whether we can take it from the club or that I have to ask the treasurer. Treasurer is missing. I have to talk to her now. So I will just talk to her and I will post it in the group. What does the treasurer say? Then we can. Okay, that's a very good idea. Okay. We'll follow that. Yeah. So, and then next month we have planned few more things. I will plan about our meetings, but I will discuss with the board and then let you all know. And I think we all have to listen carefully. There's so much frustration also. And doctor, we are waiting to hear from you. Thank you. Total information by Dr. Anachal.
Good evening to all. Protest மாசம் ஒரே ஒன்று ரொம்ப ஃபேமஸ். ஏன்னா இட்ஸ் a fertility month for dogs. But I don't know why the Rotarians are very thin today. So a learned speaker from our own club, he has recently conducted a conference for the southern district. More than 200 delegates attended, and it was a very good conference regarding the knee replacement. And it was a successful. We have to congratulate him for the excellent work he is doing now. Regarding the Rotary news, there is in West Bengal, there is a city called Malta, and where there is a club number 3240, a Rotarian past president, Bhaskar Paul, has taken community service to the tribal people 15 kilometers away from the Malta, where he planted nearly 10,000 saplings of jackfruits. And after 4 years, the tribal people, more than 1,000, benefited very much. And this jackfruit is very nutritious, and it was really good income for those people, and it is a part of the community service he was doing, and it was really appreciated. It also came in the Rotary news, and I hope we will also do something related to the green revolution of one of the things of the Rotary. Thank you very much.
Thank you, Rotary Dr. Anatol, for your Rotary information. Now I request Rotary Past President PH Sylvester Clare to introduce the chief guest.
Good evening, everyone. I am given the pleasant task of introducing the chief guest today is our own member, Dr. Srinivasan. Rotarian Dr. Srinivasan is the Managing Director and Chief Orthopedic Surgeon at Srinivasa Hospital, Nagercoil. He did his medical graduation, that is MBBS, in the prestigious Madurai Medical College in 1992 to 1998. He won the gold medal in general medicine. Followed by this, he did his post-graduation in orthopedics, that is MS, in KIMS, Hubli, that is in Karnataka state, I believe. Okay. In the year 1999 to 2003. He was conferred with DNB Orthopedics by National Board, New Delhi, in the year 2005. In the field of joint replacement, he had training in various courses in Singapore and Bangkok. Also, endoscopic spine surgery in France. Initially, he was a consultant in orthopedics in our reputed Dr. JCL Medical Trust from 2003 to 2010. He started his own hospital, that is in Srinivasa Hospital, in the year 2011, and he has been functioning for the past 13 years. He is much specialized in complex hip and knee joint replacement, keynote joint surgery, complex fracture and endoscopic spine surgery. He has a great passion in giving treatment to children with clubfoot deformity. I am proud to say our club Rotarian Dr. Srinivasan is the first robotic joint replacement surgeon in South Tamil Nadu. For our information, he has joined more than 1,000 joints. He has performed more than 1,000 joint replacement surgeries successfully with nil revision status for the past 15 years. He is a life member of Indian Medical Association, Indian Orthopedic Association, Tamil Nadu Orthopedic Association, Indian Ophthalmology Association, Indian Orthoplastic Association, Pediatric Orthopedic Society of India, etc. He is also a member of International Social Society like WES, that is World Endoscopy Spine Surgery, and also SICOT, SICOT, I don't know what is that. That is in Belgium. Currently, he is serving as the treasurer of World Endoscopy Spine Society. He has held various positions in President of Kanyakumari Orthopedic Society, Executive member of Tamil Nadu Orthopedic Association. He has presented various scientific papers, international and national state conferences. He is also a faculty in many CMC and workshops. He was organizing secretary of national and international conferences. He is the founder member of BNI with rich networking experience. With his more than 20 years experience in the field of orthopedic, he serves in the motto of quality care at affordable cost. So when you come to the family details, he is a native of Tindikkal, Tamil Nadu, settled in Nagercoil 23 years ago. He joined Rotary in the year 2007 when Rotarian Sunil Richardson was the president. His wife, Dr. Sunita Vasan, gynecologist and fertility specialist. He has Shoy Jeevan Fertility Center. And the couple is blessed with 2 sons. The elder one is here, that's Dr. Deepan Kishore. The younger one is Jayis Vishwan, studying MBBS. That's all with this, and he is going to talk on the topic robotic surgeon for knee pain relief. So we are very anxious to hear about you. Let's have the pleasure of listening to our own member, Dr. Srinivasan. Thank you.
Thank you very much, class president,
Sir, where?
உடையில இல்லை ஒன்றும் இல்லை இது மட்டும்தான் ஓகே ஓகே ரைட் ஃபஸ்ட்டு பிபிடி ஃபஸ்ட்டு அதை காமிச்சு இது நீ மினிமைஸ் பண்ணிட்டு அதில் விட ஆன்லைன் மாட்டி இது ஃபஸ்ட்டு போட்டு செகண்ட் ஸ்லைட் Good evening all. First of all, I thank our President, Secretary and all office bearers and senior Rotarians, everyone who has invited me as chief guest. Thanks for the opportunity, sir. And it is a great opportunity to visit the club also because I am having very poor attendance in the club. So this is one opportunity to at least attend one meeting properly. So thank you very much. So this topic why I selected because most of our Rotarians we are, as you told, everyone is aging and our country is also aging. More people are aging more than 60, 70, 80 is common nowadays. So everyone is going to suffer from knee pain. So better to take some key points on that and how we can prevent and how we can manage it. So I have 2 presentations. One is the basic one to know what is osteoarthritis. This one I took from the internet. So most of the people older than 65 years, they have evidence of osteoarthritis. So osteoarthritis of the hip and knee is a common cause of disability in that, and sometimes in hand. Hand we don't worry much because it's not concerned with any mobility. But hip and knee joint is very important. So obesity is very important thing. So everyone now talking about weight loss. So that is true. because once you have more and more weight, it is going to cause more damage for your joints. So it is a very simple thing, is saying that every 1 kg you gain, so that gives 3 kg of pressure on your knee and 6 kg of pressure on your hip. That's why we are asking everyone to lose weight, because once you put 1 or 2 kg weight, that gives a very big impact on your joints. And another thing is overuse, like athletes and muscle weakness, aging. So all these things are risk factors for your osteoarthritis. So தமிழ்ல சொன்னா osteoarthritis மூட்டு தேய்மானம். மூட்டு தேய்மானத்தை நம்ம osteoarthritis அப்படின்னு சொல்லி சொல்றோம். So then we come for the pathophysiology. Why it is happening is because the cartilage is gone. குருத்தெலும்பு அப்படின்னு சொல்லக்கூடிய cartilage வந்து, so that becomes more and more damaged. So once we age, so this is called the primarily begin in the articular cartilage. So that smoothness of the cartilage goes away and your joint becomes worn out. So that worn out joint is called a osteoarthritis. So that represents a gradual process of destruction and degeneration. So we cannot prevent that. Some people get the osteoarthritis in 40 years, some get in 50, some get in 60, 70. So genetic makeup is also important. So cartilage becomes thin and becomes denuded. So slowly they become denuded and we get the arthritis. So once we get the arthritis, we start having pain, swelling, unable to walk, unable to move the joint. So everything happens. So subchondral bone, once that superficial surface is gone, then the bone is exposed. Then you become more and more painful. So this is what is simply shown as the hip joint. We can see the ball here and there is a cup here. So this is called a hip joint. So here also many times this joint arthritis happens. So more of the time in Western countries we have more hip arthritis. But in Indian setup, more than the hip, we are suffering from knee pain. So that is the thing, we can see both here. So again in the hip also, due to injury, due to some other diseases, various other diseases, steroid intake also can cause a softening of the bone and can cause a hip arthritis. So how do you feel that? We feel a pain in the groin, buttock or in the thigh. So gradually it goes for a limping. So we see somebody walking with a limp. So that is because of the hip joint arthritis. So once we take an X-ray, we can see that it is worn out here. So this worning out is called a hip osteoarthritis. So this is shown in the figure here. So what we can do, initial days we can take some medicine, physiotherapy, physical exercises, all those things. But once it is crossed a certain limit, then we need to go for a total hip replacement. So total hip replacement, this is a artificial joint. So that ball and socket is taken out and we put a artificial thing. So this science is very much advanced and they have life more than 20-30 years also it can last. Materials like titanium, cobalt, chrome, everything is there, so give a very good result. So this is a cemented hip replacement. Sometimes we change only the surface, only the head is changed. So that is called a surface hip replacement, which now we are not doing much. Total hip replacement is the mainly we think. So now we can see what is happening in the knee joint. So you can see some stages of knee here. So this is a very good cartilage. It is very smooth and glistening and white. Then slowly this arthritis happens here. So we can start having little bit pain, mainly on climbing stairs, climbing down and standing for a long time we are having a pain. Then slowly it goes for a stage 3. So the cartilage is more and more damaged and you start having pain even at rest and you can stand for more time in the kitchen, not able to do work. You can go for a shopping like that. Then you go for a stage 4 arthritis. So now the damage is more, the bones are getting crooked, your leg becomes bow leg or a knock leg, so something like that. So gradually you have a very severe symptom. So initially we go for a pain control thing like medicines, physiotherapy, ointments, all those things. You can go for a physical exercise also. And sometimes we go to the Synvisc is an injection which we give into the knee joint. Many of you would have had that. That's a visco supplementation they call. So that oil type of thing is injected into the joint. So in stage 2 or 3 we can use this injection. That is called a hyaluronic acid. So it's like putting oil for a worn out machine. So machine change pona oil போடுற மாதிரி நம்ம ஜாயிண்ட்டுக்கும் oil போட்டுக்கலாம். So this is one non-operative treatment. But once you cross certain limit, then we go for a osteotomy or joint replacement or total knee replacement. So that is for a very advanced stage. It's for a little bit advanced stage, you can do a osteotomy. So you can correct the deformity. If it is crooked, then make it straight. So that is one type. So once you go for a little bit more, now this is the latest thing. Instead of total knee replacement, we can do a partial. Whichever is worn out side, you replace only that. So other side will be remaining. So that is a good thing. After this, patient can squat and they can sit cross-legged, everything is possible, not like a total knee replacement. Once you cross that limit, so this is called all compartment. This compartment is gone, this compartment is gone, all is changed. So total damage means then we have to go for a total knee replacement. So it is nothing but removing the surface which is worn out and put a new metal. So this is the metal here, and everything we can do like moving or standing, walking, climbing stairs, everything is possible with a knee replacement. And very rarely we have an ankle arthritis. Somebody with a heavy weight and like obesity, with people who are in athletic, repeated damage to the knee, ankle joint, they can have an ankle arthritis. We can do replacement for the elbow, ankle, and even in shoulder also. So these are very uncommon joints. Common joint is hip and knee replacement. So this is to show you how we can treat the arthritis of the joint. So thing is how we can prevent. So everyone's question is not about surgery, because many people will be afraid of surgery, so they want to know how we can prevent going for this stage. Means number one is you go for a proper exercise, so, and reduce your weight. Don't put too much of burden on your joint, and take some medications like calcium and vitamin D, especially for women. Postmenopausal, go for osteoporosis. Once the bone is soft, then they can go for a osteoarthritis also. So better to keep your joints supple. Do common exercise like walking or jogging, whatever is possible for you. Keep your weight in check and take some supplements like calcium, vitamin D, and exposure to sunlight. So that is also important. And taking good food rich in calcium and vitamin D. So like fish, dairy products, milk. So that is very important to keep your bone health. So these are all the things where we can prevent a osteoarthritis. So this is my part of this thing. Now we go for the second part. So this is to know just everyone about a little bit about osteoarthritis. Now I will go to the second part of the thing, where I want to show what kind of treatment we are giving. So as Sylvester sir introduced me, so our hospital is into so our hospital is crossing 50 years of excellence since 2015. Video So short introduction about our hospital. So ours is a 50-bedded hospital located at Nagercoil, Nagercoil. So since the beginning we are always into making technology more introduced into our system, either orthopedics or fertility or anything. So that's why we bought the robotic knee replacement also. So this is a short video about what are the facilities we have in our hospital. So it is having a 24 hours laboratory, X-ray, digital X-ray, outpatient department, physiotherapy department. And we are having all kind of insurance facilities also available, including Star Health and government insurance. And even retired people are getting this pensioner scheme also is available. And our hospital is NABH3 accredited. This is the operation theatre with all kind of latest equipment. This is one more operation theatre. So this is the robotic machine which we are using for the joint replacement surgery. This is our neonatal unit, inpatient unit. The IVF lab, and we are doing the test tube baby. My wife Dr. Sudha, she is handling the fertility department. And all latest technology like blastocyst culture is available, 24 hours pharmacy, canteen, and all facilities are there. So this is a robotic assisted knee replacement presentation. Actually this is a presentation meant for doctors, but many of our club members are doctors, so I brought the same thing, but I will run through that very fast without boring much. So why you need a knee replacement? Many people tell that sir, operation illama enna panna mudiyumo pannunga, adha first solradhu. So adukku ஒரு stage irukku. So when we cross that stage of knee pain, where it is limiting you, where the this thing your difficulty is more. So the thing is you want a pain relief. So severe joint pain, extensive distraction, gross instability. So leg becomes shaky, you are not able to walk, marked deformity, severely crooked legs. So on previous treatment, all it is failed. Then you go for a knee replacement. So why you need a knee replacement surgery? So this is the knee replacement. Pain relief is good mobility, stability is there, improved activity is possible, greater independence. So people old age they can walk independently and better quality of life and cost effective treatment. Psychologically you feel better and you are feeling confident. So that's why you go for a knee replacement. So forget your joint pain and feel the happiness of life. So this is our motto. This is where we inaugurated the robot in 2024. And I am glad that our Rotarians, many of you came for the function and graced that occasion. Thank you, sir. And this is the robotic machine. So it consists of two parts. This is one part and this is one part which is attached to the operation table. So why it is important means it's a cost-effective procedure, knee replacement. But many people, we have seen that people will tell you, after knee surgery I am not able to walk properly. So that is a complaint shared in about 30 to 40% of people. So to clear that problem, we want 100% relief. We don't want any complaints after. So that's why robotics have been started. So this gas, 15 to 20% people are not happy. So that's why we want to make them happy, and we bought that robot. So a well-performed knee is one which gives a good functional outcome and stability and long-term survivorship. If it is not done properly, that may lead to poor functional recovery. We can see that even in an automobile industry also we are using all kind of alignments, balancing and robotics. So we can use it for even for human it is very important. We cannot tell only manual technique is better nowadays. So eventually robotic gives a better positioning, alignment and soft tissue balancing also. So the functional outcome is very good. So these are the 5 robots available in India. So this is the one which we are having from Johnson & Johnson USA, Bellis robot. It's a very good one, it's the latest one. So these are the advantages which you are shown here. It's very compact and mobile, no radiation exposure is there. The camera is very speedy and we can do the surgeries very perfectly. So till now we have done about more than 100 surgeries. That's why we conducted a conference recently. And all 100 patients are doing well and it is a most successful surgery. So these are the technical details which will be difficult for you to understand. So this is a very small video of just 1 minute. Just if you want, you can see how we are doing a replacement surgery. So this is how we are opening the knee joint. These worn out parts are removed using instruments like branches. So this what we are seeing is the part. So to attach the robot, we have to put the sensor in the knee joint. So 2 sensors will be in the leg and 2 sensors in the thigh bone. So these sensors will be seen by the robot. So the robotic machine will be taking the bone cuts. So this worn out part will be removed and whatever we do is shown on the camera. In manual technique we cannot see this kind of thing. So this patient is having 12 degree of bend. So this will be corrected eventually. So surgery will be entirely surgeon controlled, but robotic will be assisting us in taking the cuts and maintaining the balance of the knee joint. So this is showing the measurement, how much we are going to do. So at the end of the surgery, they are having 2 degree. So from 13 degree, we have corrected to 2 degree. So this kind of every degree of correction is not possible with the regular conventional surgery. So robotics makes the life easy for the surgeon and for the patient also. So this is the final thing. So same thing will be reproduced in the life. So this is the picture of the knee joint after removing the worn out parts. So this is a raw bone. Then we give a wash and put a bone cement which is white in color. So this is the cement which we are mixing. The cement will be put on the bone and the implant will be implanted. That's all. Once we put the artificial joint, then it is fixed there. And now we close the joint and all movements and all kind of function is possible now. So this is the joint which is shown here. And it is a very most important and very complicated and very sterile surgery. So the operation theatre, everything has to be very much equipped for this. So not all knees are same. That's why we are doing this. So everyone is having a different type of knee, different sizes. Somebody is having a straight knee, somebody is having a bent knee. So this robotic means personalized replacement surgery is possible. So this is the thing for a 10-year survival is more than 100, nearly 98% survival is possible once you do the surgery properly. So I want to show a few cases for you to show it important. So this is a patient. He is from Vallur. He had a bent knee and this kind of deformity. And this is the implant which we are putting. This is a new implant. So he is able to walk well after surgery. He is able to walk freely. He can easily walk and go for normal work is possible. So we cannot identify who has done this knee replacement. So if this kind of bent leg is now made into straight one. And this is again it's a 70-year-old female, so very difficult to walk. So even for above 70, 80 years also, we can make them walk happily after the surgery. So you can see how the knee joint is destroyed here. And this is the replacement done, and she is straight and happily now walking also. So this is the X-ray after the surgery. So these are common sites we will be seeing more people. So how difficult they are walking there, but after the surgery they are very happy. So the knee pain relief is good, and the functional aspect also they are feeling very happy. So this kind of bent knee like this. So it's totally damaged knee. After surgery it will be looking like this. Since we are doing with the robot, all knee will be same after surgery. Everything will be looking at the same level. So she is now with a very straight leg and she can walk and do all kind of kitchen work. So these are very last stage patients. We can see many people in our family and friends also. They are very difficult to stand also. So even this they can do surgery and make them walk. So these are a few examples. So they can walk and do their work happily. So he is a retired professor, even 75 years. So he got his knee replaced. He came only for this robotic. He is very interested in that. So he came, and now he is working and he is a very strong advocate of knee replacement for me also. And he is sending so many patients. And he is a retired headmaster. Again, he is I think 70 plus age. So he was finding very difficult to walk, and he was crying with pain. And somebody has to hold him. And he was more than 90, 95 kg weight, and he could not bear this thing. And we did a knee replacement like this, and both knees were replaced. Within 1 week, we did both knee replacement. His leg became so okay, and he became normal. And he could not believe that such good function is possible after a knee replacement. So he is now walking without support, and he is sending other people who are suffering from knee pain like that. And I am thankful to Arnachalam sir who has sent one patient for knee replacement. I think 2-3 years back. She is doing well. So he is showing the hand. He is not using the stick anymore. So that is the success of the surgery. It's many of the more difficult cases which is difficult for you to understand. So I will just run through the slides. So all kind of problematic knee is correct. So these are the advantages of robotic surgery. So accuracy is good, bone cuts are good, so better range of motion, better rehabilitation, no physiotherapy is needed. But the limitations are there. The learning curve is there, and the equipment cost and maintenance cost, everything is there. So it's a new era, and technology is here to stay, and this robot makes it easy, as I told, for the surgeon and for the patient. So improved compound positioning, personal surgical procedure is possible, and reduce the cost in high volume hospital. So the final conclusion is surgeon intelligence and artificial intelligence both have to be combined to create happy patients. So this is the thing. And the certain questions are there which you may be interested to know. What is the cost of the knee replacement surgery with robotic technology? So usually it is costing around 2 to 2.5 lakhs. And how many days stay is needed? Minimum 3 to 5 days will be needed for a knee replacement. Can we do both knee replacement at the same time? Yes, we can do at the same time, depending on the condition of the patient. Condition is very old, we can do one by one. They are like a little bit 60 or 65, we can do at the same time. What is the lifetime of knee replacement? Minimum 20 years it can last. Is there any complications? Some minor complications are there, but very rare to get major complications. 99% it's a very safe surgery only. Thank you very much and thanks for the opportunity. So if there are any doubts, either regarding the basic doubt or regarding the surgery doubt, you can ask 1 or 2 questions we can take up, then I will line up.
Over to all. Anybody have any doubt can ask.
Compared to male and female, who is getting more of the
Arthritis. Yeah, it's a good question, sir, because less than 60 years, many times we are having male patients. Once you cross that 60, 70 like that, more female people are affected. Once you that menopausal age, more women are affected. Young active people, working people, then we are having a little bit younger people, like 60, 55, 60, we are having more men. Generally, women are more affected. Early stage of arthritis அந்த மாதிரி வரும் சார். இப்போ நம்ம மெஷின்ல இருந்து சவுண்ட் வருது இல்லை, கரகரன்னு ஓடுது இல்லை, அது மாதிரி ஃபர்ஸ்ட் ஸ்டேஜில் கொஞ்சம் கொஞ்சமாக அது ஓடி அதுக்கப்புறம் தான் அது தேயும். ஸோ அந்த ஸ்டேஜில் வரும்போது நம்ம வந்து கொஞ்சம் மெடிசின்ஸ் கொடுக்கலாம். நான் சொன்ன இந்த விஸ்கோ சப்ளிமெண்ட் இன்ஜெக்ஷன் இருக்கு இல்லையா, ஜெல் இன்ஜெக்ஷன் அது போடலாம். இப்போ நிறைய பிஆர்பி இன்ஜெக்ஷன் கூட போடுறாங்க, பிளேட்லெட் ரிச் பிளாஸ்மா. ஸோ சம் ஏர்லி ஸ்டேஜ் ஆர்த்ரைட்டிஸ் வி கேன் கிவ் இன்ஜெக்ஷன். ஸோ அந்த சவுண்டுக்கு அது கொஞ்சம் யூஸ்ஃபுல்லாக இருக்கும்.
Congratulate you for your
surgical method and robotic surgery. You have done more than 1,000. And I have to thank you for a lady. She was coming crawling actually, and just I put you and you said just refer the case to me. And after 2 or 3 years, a lady came in the upstairs, and I did not believe. She said, Doctor, like that she was telling. And absolutely she was free from all problems. And I was happy that you have done a very good job for her. So thank you for your excellent presentation.
Thank you, sir. Thank you.
Can you explain the reason for frozen shoulder?
Shoulder. Frozen shoulder is common in due to one thing is age-related degeneration. Another important contributing factor is diabetes. So another important thing is diabetes. So aging, diabetes, and sometimes injury. So after injury, sometimes you are not able to move the shoulder for some time. It goes for frozen. So active exercise daily will prevent the frozen shoulder. But once the frozen shoulder sets, it is difficult. Then you go for physiotherapy. Sometimes injection will be useful. It's a curable condition only. But diabetes has to be kept in check. Many times diabetic patients get more of periarthritis. It's called periarthritis, and common language is called frozen shoulder. The pain is very severe, especially at night. You cannot tolerate the pain. Not able to raise things, not able to do work, lifting, and so it's possible. It's a very painful condition only. Okay. Thank you. Thank you.
Anybody else? So let's all appreciate him for clarifying our doubts and also wonderful topic.
எடுத்துட்டாங்க.
I request past President Subramani Murthy sir to honor our chief guest. Subramani Murthy sir.
Sir, ready? Thank you.
In your request, Rotary President Joseph to propose vote of thanks. Good evening all.
First and foremost, I want to thank our President and Secretary for giving me this opportunity. நான் இங்கே வரும்போது ஆல்ரெடி இதெல்லாம் முடிஞ்சிச்சு, ஃபோர்வே டிஸ்ட்ரிக்ட் முடிஞ்சாச்சு. அப்புறம் கேட்டாங்க யார் ப்ரேயர் சொன்னாங்க, அதெல்லாம் பார்க்கவே இல்லை. அப்புறம் தான் நான் கேட்டு பண்ணியிருக்கேன். And thank you, Rotary Radhakrishnan, for saying the invocation, and Rotary Ramalingam for saying the four-way test, and welcome address by Rotary Melody sir, and Rotary news by Dr. Arnachalam, and chief guest introduction by Rotary Sylvester sir, and I'm thanking our Honorable Chief Guest Dr. Srinivasan. I'm seeing him for the first time. I'm very happy that he is our member, and he is meticulously and very effectively speaking about the advantages of the robotic assisted surgery. It's very, because most of our members are senior members, and it will be very helpful to all of them. And I too will soon bring you one patient. I have known her from our family. She is suffering a lot with knee pain and all. So, and it's very good to hearing all the causes of that, whichever made the pain in our knees, and he's talking about the frozen shoulder and all. Okay. And then how to take care of our health, mainly because of the obesity. So we'll be very careful in our future also. And by taking this kind of treatment, our pain will be relieved and improved mobility in our actions. And he explained well about the advantages of the replacement surgery. And I'm thanking each and every one of you for making this meeting a very successful.
Thank you, Rotary President Joseph. Now I request PDG Dr. Nestor Dharma for some few informations.
Good evening, dear friends. Let's start our times. I request an information to all of you also. So there are some questions raising about continuous projects on computer center, about computer center and also spoken English center. I think each and every one of you, you have got the right to talk about it and also to come and visit and to know about it. You are free to come anytime during the working hours, and you can talk to the candidates there, and you can always get information about the payment, about the money dealings in the two centers here. And my humble request is to the President to conduct a club assembly soon, where we can have an open discussion about the two ongoing projects that are going on. Thank you very much.
Thank you, PDG Nestor Dharma. Now it's time for the national anthem. I request Senthil to.
जनगणमन अधिनायक जय जय भारत भाग्य विधाता
पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उज्जल जलधि गंगा तव शुभ नामे जागे तव शुभ आशीष मागे जागे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे